So I think it's a really exciting time right now in bladder cancer. There's 5 agents that are now FDA approved for the treatment of metastatic advanced bladder cancer. And one of the trials that I conducted using Nivolumab led to that approval of this agent in metastatic bladder cancer. And at this meeting at ASCO 2017, we present the updated data of the pooled analysis using Nivolumab. So the data has the study is pooled because it has 2 data sets. It has the initial 44 patients that we enrolled, and then it also has 200 additional patients that we expanded to assess efficacy. And in the pooled analysis, we looked at the patients with the median 6-month follow-up of 6 months, and of those 161 patients, we saw an overall response rate of 17.4%. So, and this has been consistent with all the other agents that we have seen, Nivolumab, atezolizumab, pembrolizumab, just to name the other agents that have also been FDA approved for bladder cancer. The range of overall response rate is about 15 to 20%. So I think that the next step is how can we do better? How can we improve upon these responses? And perhaps can we take patients that would be non-responders and make them responders? And I think that that's the goal with a lot of the combination immunotherapy trials that are ongoing right now. Because there's a lot of agents that could potentially enhance the immune system to make the tumor more responsive to these checkpoint inhibitors. So one of the trials that we are presenting here is the combination of Nivolumab and Cabozantinib. So it's actually Cabozantinib, Nivolumab, and Cabozantinib, Nivolumab, and Ipilimumab, also in patients with metastatic urothelial carcinoma and other genitourinary tumors. So we saw a very nice response rate in the first 48 patients. We saw a response rate of 37%. And when we looked at the bladder cancer cohort, it was a response rate of 44%. The progression-free survival with a 12.4-month follow-up was 12.8 months. 7 of the responders that were bladder cancer were still responding. So I think there's something to be said about the combinations, and it's one of many combinations that are ongoing right now, trying to improve upon what we have with the checkpoint inhibitors.